Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. We recently marked 1,000 days since the first COVID case in the GTA back in January 2020. Since that time, we've been through a lot together, and fortunately, we faced it together, all engaging more or less with the same challenging reality, though often in different ways and to different degrees. And there's no doubt that it affected us each differently. This fall, in this phase, perhaps even more than previously, we do have two different realities. One in which COVID is largely behind us and normalcy has somewhat returned, and one in which COVID remains an everyday concern, accompanied by other challenges. On the one hand, we have much of the population of York Region and of Ontario, for that matter, that have moved past COVID or learned to live with it, and for whom what's happening in acute care sector is only of passing interest. On the other hand, there are those who work in healthcare or in public health or have loved ones who are interacting with healthcare or they themselves are, who are very much aware of the unprecedented and dire situation we are in at this time. The crisis in healthcare that we're facing is part acute COVID pandemic related and part chronic pandemic related. The pandemic continues, and we still have high numbers of people who are ill and in hospital with COVID illness, almost 2,000 people, and that puts a significant strain on acute care. We also have a high number of deaths, higher than we've had in many, many months. Now, these deaths are occurring mostly in people with other serious illnesses, and our ICUs are not overwhelmed with COVID right now. But these deaths are still tragic, premature, and preventable. But the second crisis, what I've called chronic pandemic related crisis, is not directly due to COVID, but due to its after effects on our society. The dramatic increase in respiratory illnesses like influenza and RSV are an unavoidable product of our success combating COVID over the last 2+ years. We knew that it would hit us, and it has just when we have so little reserve capacity to deal with it due to the health human resource crisis that is a result of burnout, fatigue, retirement, and illness in our healthcare providers. So what can each of us do? What can we collectively do to improve the situation? The easiest thing you can do is to get vaccinated. You've heard it from me and many, many others many times before, but it remains critically important. While we don't have vaccine protection from things like RSV or other respiratory viruses, we do have excellent vaccines for both COVID and flu. The bivalent vaccine, either Moderna or the Pfizer version, both available now, protects against Omicron, the main variant we're seeing in Ontario and around the world. If you've only had 2 doses of vaccine, and there are almost 50% of York Region residents under 40 who haven't had a booster, you are the ones who can make a difference population-wide. While most people at higher risk due to their age or other conditions have been vaccinated with at least 1 booster, and many with 2, it is younger, otherwise healthy people who have only modest protection now left from their original doses that could certainly use boosting to protect themselves as well as others and the healthcare infrastructure. The BQ and BX variants you may have heard of are outcompeting BA5 in Ontario and globally. We have no indication that they are more severe or evade immunity from vaccine or infection, but we will need to see how things develop. These variants are still Omicron related, and the Omicron vaccine we have now and that is available will offer protection. Also very important is the flu shot. Influenza cases are rising quickly and rising early for this season across North America, York Region, and Ontario. To make it easier than ever to get your COVID-19 and your flu shot, our COVID-19 clinics in York Region will start offering both the flu shot and the COVID-19 vaccine together starting November 1st. This means that anyone 5 years of age and older can get both vaccines at the same time. Kids aged 6 months to 4 years can get them 14 days apart. And you can certainly get either one of these separately if that's what you need. You can also go to your nearest pharmacy for both of these vaccinations if it's more convenient for you. Vaccine appointments for COVID-19 and influenza vaccine at York Region Public Health Clinics can be made at york.ca/COVID-19 vaccine or by calling Access York at 1-877-464-9675. I know there's been some confusion about whether to wait 3 months or 6 months from your last dose or having been infected. Let me try to clarify. When the advice to wait 6 months came out earlier this summer, COVID cases were on the downswing and influenza was not yet a concern and RSV wasn't really on people's radar. The situation has changed and the surge we expected is starting to materialize. For this reason, for many people, it does make sense to get your bivalent booster now, before the surge grows further. So as long as it's been 3 months since your last dose or last infection, it's prudent to get your bivalent vaccine now. Certainly, if you're at increased risk of serious outcomes, there's no better time than the present. My plan is to get my bivalent and my flu shot this week. Another way to help protect those around you is to stay home when you're sick. If you're feeling symptoms of COVID-19, influenza, or any respiratory infection, or even a stomach flu, please stay home until your symptoms have improved and until you're fever-free for at least 24 hours. Practice good hand hygiene, especially if you've been sick. And lastly, masks. I started my message today describing two realities, both being true, and one's perspective on masks depends on one's daily experience. You will certainly hear pleas from healthcare providers, hospitals, and other concerned citizens, and recently, the former chair of the Ontario Science Table, for the reinstitution of some form of mask mandates to combat the acute and unprecedented crisis in healthcare that we are facing right now, including in hospital children's wards. I've certainly received many such messages. There are also those who are very much opposed to mask mandates, who believe that masks should be an individual's choice at this point, or that while masks would be wise and impactful, attempting to enforce mask mandates in the current context would be impossible or unwise. As always, public health decision-making depends on both medical and epidemiologic sciences, as well as social science, political science, and those realities. As the current phase of the pandemic progresses and evolves, medical officers of health across the province, as well as the Office of the Chief Medical Officer of Health and others, continue to weigh the risks and benefits of further action. I don't foresee any action from York Region Public Health in isolation from our colleagues across the province at this time. For now, while masks are no longer mandatory, masks are still a proven way to stay safe and protect yourself and others from COVID, from flu, from RSV, and a host of other respiratory illnesses. If you are able and willing to wear a mask in indoor public spaces, that's great. If not, it's certainly a good idea to at least have a mask with you if you're in a confined space, in a crowd, in an unpredictable situation with those you don't know, or if others are uncomfortable maskless. For example, you may want to consider having a mask with you or on your face if you're going out trick-or-treating or handing out candy or healthy snacks at the door. This Halloween, let's share tricks and treats, but not viral respiratory infections. Happy Halloween to those who are celebrating.